Hi everyone, Dr. Becca Knackstedt here. Today, let's answer this really commonly asked question. So you're a patient, you're preparing for surgery, you met with your surgeon, but your surgeon's the only person you've met so far. Who is actually doing your surgery? This is a very valid question, and I have a lot of patients ask me this before surgery. But the answer depends on a couple things. It probably depends on what type of surgery you're having, and it also depends on where you're having that surgery. I work in an academic center, which means that most days I have a plastic surgery resident who is helping me and whom I am teaching as I do the surgery. Sometimes I have a physician assistant who's helping me. If you're in a private practice setting where there aren't residents, usually there's a physician assistant or a surgical assist that is assisting in the surgery. Now, how much that other person does in the surgery is really dependent on a couple of things. First off, it depends on the complexity of the surgery. A lot of surgeries, you really need someone to help you. So you need to have someone retracting tissue or helping you if it's a really long surgery, just speed things up. I dictate how much I let the residents do based on where they're at in their training and how much I trust them to do. If it's an intern or a low-level resident, they probably won't be doing much. They'll just be observing and learning. But if it's a chief resident or a fellow, then they probably will be helping with the surgery and doing part of the surgery. That's the way that we were all taught how to do surgery, and it's called graded autonomy. But if you're a patient and you're preparing for surgery, this is a very fair question to ask your surgeon, and your surgeon should be able to answer the question. So go ahead and ask your surgeon, and let's see what they say.